Hi, I'm Kenneth Cutbush, an orthopaedic shoulder surgeon working in Brisbane. I'm with Lucy Angelini, a shoulder physiotherapist who works with me in the clinic. We're talking about AC joint excision and rehab after that operation. So, Lucy, AC joint excision, this is an arthroscopic operation typically done for patients that have an arthritic AC joint. Now, pretty much everyone over 30 has some degree of arthritis in their AC joint. But the people we're talking about having the surgery are ones where they've stirred that shoulder up and it just is not settling down. Typically, you'll see on the MRI scan high signal or edema, bone bruising in the bone on either side of the AC joint and some fluid around that AC joint. And those patients, we will be talking about an AC joint excision. They will have had rehab, they'll have had usually cortisone injections. But if none of that is working after months, then we consider an AC joint excision. Now, this is something I do arthroscopically, and what we're doing in this situation, you have bone rubbing into bone because the joint's arthritic, all the cartilage is gone, it's been worn away, and just got bone rubbing into bone, and that's why it's so sore. And if I create a gap between the two ends of the bone, and typically we need about 5 millimeters of resection minimum, but we don't want to take off too much. That will then decompress that joint so there's no longer bone rubbing into bone, and over time, fibrous tissue will tend to fill in between. And while that isn't as good as the cartilage you had when you were 20, it's a lot better than bone rubbing into bone. And it normally does very well long term. Whether it's perfect or not, that's probably not perfect is the thing. But if someone's got a very sore AC joint, it makes a huge difference for them and gives them back the ability to go back and play sport and get into their life. So it's a keyhole operation. So you'll be in hospital one night, and the next morning you'll see the nurses. They'll change your dressings, and you'll see the physio. Of course, you'll see me. The physio is going to take you through the rehab. Now, you'll have a sling post-op, but you do not need to wear the sling, so that can be done away with then. You don't need to wear the sling out of hospital. The sling's there for comfort, though, if you do need to put it back in and rest it up a little bit. And you'll be able to get going, and within a few days, you'll usually be able to drive once you're able to control the car safely. So what is the physiotherapist going to run through with them before they leave hospital?
Yeah, so it's a nice operation in that we don't have anything to repairs to protect. So sling for comfort. So often, for the first week, you'll be, in and out of the sling just while everything settles down. So the physio will show you some active range of motion exercises before you leave. So moving the shoulder in all directions. We've got a nice little program that we give you. So some shoulder stretches. We encourage you to use your arm for all your light day-to-day activities. And we just don't want you to do any heavy lifting. So nothing much more than a cup of tea in your hand. But moving it, don't protect it too much. We want to start getting it going. And you can see your physio weekly during this first phase of rehab to progress your stretches and, make sure that your shoulder blade's in a really nice position. And they'll normally do a bit of soft tissue work as well and just encourage you along the way. Make sure you're progressing appropriately.
Yeah, so it's not too complicated from the physiotherapist point of view.
No,
because it's
nothing
more
to
just
protect.
nothing to protect. So I guess make sure you know how to go through showering just for the first few days while you're still sore. Talk to the nurse about the dressings and what to do with them. And in this hospital here, you'll leave hospital about 10 a.m. So just to know that. Now your physio, my office will send your physio the details of the operation note, and of course you've got the little video from me explaining what the operation was. Show that to your physio, and in your pack you'll have the rehab protocol, the physio rehab protocol for your shoulder, so take that along as well to your physio. But we will have already sent that to them. So the first visit with me is at 6 weeks. What do we do at 6 weeks?
So at 6 weeks, we have a look at your range of motion. So you'll normally take a video. And if it's all coming along nicely, your pain's improving, your movement's probably not full, but getting close, then we can look at starting some strengthening. So we start by strengthening your rotator cuff and your scapular stabilizers and start to give you some advice in terms of timing, in terms of what activities you want to get back to. It's a nice time in the rehab. You're starting to feel, like you've got your shoulder back.
Yeah.
It's still weak, but it should be moving well and pretty comfortable.
Yeah, so at that point in time, A lot of patients are very much pain-free. The range of motion is back, and we're actually starting to get into some strengthening with them, aren't we? Just very light. You have to go slow for the first 3 to 4 months. It does take that time to get over this operation. The healing process, even though it isn't a big operation, a big reconstruction operation, the healing process is still the same length of time, which is really 3 to 4 months. So we're going slow. Some patients are not quite there at that point in time. They're still a little bit tight, and we will see you back at the 12-week mark for a review at that time and reassess the shoulder and look at your rehab, the physio, from the physio point of view, won't we?
Absolutely. Yeah. Yep. So at 3 months, we're hoping that your strength's, coming back. You're starting to think about, returning to the activities that you're wanting to get back to. But we avoid any sort of heavy, or overhead work until about 4 months.
Yeah, that's really the key thing there, isn't it? You don't want to do the heavy overhead work, and contact shouldn't be for at least 4 months, is my opinion on it. Anything else we've missed?
No, it's a nice rehab process. It's 4 to 6 months.
I think that's a big thing, is just to reassure people, because if being a lesser operation in terms of not being a big reconstruction, people are sometimes surprised when the shoulder's still aching, at that 6 to 12-week mark. That's common for it still to have an ache, still healing. Some patients are a little tight still, aren't they? But the range of motion comes back. We haven't seen anyone that doesn't get their range of motion back, so you don't need to stress about it too much.
Absolutely.
So that is the post-op rehab for an AC joint excision, which we normally do for an arthritic AC joint. Thank you.